Okay. Thanks for giving me this opportunity to present this ongoing work. I really wanted to share the paper with you before the presentation, but we are still sort of finalizing the writing part of it. So this is a joint work with Gaurav, who's an assistant professor in University of Virginia Business School, and we are interested in trying to see whether political institutions, broad political institutions, shape how countries respond to a national crisis like the COVID-19, and we are using this coronavirus pandemic as a context to study this question. Um, and we think it's an yeah, and we think it's an rare context that allows us to answer this question rather precisely. Even though countries all around the world have had to deal with various kinds of national crises from time to time. So natural disasters, nuclear accidents, humanitarian crises of various kinds. Uh, um, However, and there are papers that do try to answer this question. They want to see whether, for example, say, democracies respond differently to natural disasters than autocracies. Uh, However, in most of the studies that are out there, they use within country variations in institutions which are often endogenous to the voter or the population preferences, which might affect the preparedness with which countries respond. So we think with the coronavirus pandemic, we have a context where we can answer this question much more precisely. In the study so far, so what do I mean by it's not that easy to answer? So even if, say, for example, we were to compare floods of even similar magnitude for the same country over a long time horizon, countries may have learned about how to deal with natural disasters or shocks of similar nature, and they could have built organizational capacity over time to respond differently to similar shocks, say floods, and therefore, and the capacity to learn over time may be endogenous to changes in institutions. So some of these co-move together, and therefore, sort of looking at correlations over time, maybe over long time horizon, may be problematic in that way. So in that sense, the current pandemic sort of addresses some of those challenges. First, we know that an overwhelming majority of countries were affected by the same crisis, and that also in a relatively short span of time. And even though within the medical community, there were some people were aware that there's possibility of such kind of an outbreak, but it seems clear that the political leadership in most countries were completely unprepared. They were caught unaware of this kind of a crisis. And moreover, there were more or less broad agreement among experts on the nature of the response that is required. So for example, experts pointed out that there should be restrictions on movement of people, and public gatherings should be banned, and there should be testing and contact tracing to figure out how the spread is moving through the population. And therefore, we can sort of measure how aggressive various countries were once they were exposed to the virus on these parameters, and then try to see whether political institutions shape these responses. Okay. So that sort of is, yeah.
Sabyasachi, can I ask a quick question?
Yeah.
So, you're saying here that all countries were hit by the same crisis, And so I just wanted to know, I mean, so my sense was that although it's the same virus, really the kind of crisis that the countries are dealing with might be very different because of different demographic structures, different health capacity. And so the optimal response may in fact be different in different places. Is that something that you're going to think about?
Right. So exactly. So we are not arguing that they need the similar degree of the same response. So for example, various social scientists, especially economists, have pointed out that developing countries should not be locking down as stringently as, for example, the Western countries have. But there is agreement that there should be some restriction on movement and some restriction on having public gatherings. The agreement is on the nature of the response, but there is disagreement on to what extent the degree of the response, and we want to see whether countries differ on the degree of the response.
Yeah, thank you.
And I have sort of alluded to some of the initial literatures. The papers by Beasley and Burgess and Cole et al. 2012, they are on India, looking at various states over time and looking at weather shocks and how government relief measures respond to that. And Beasley and Burgess look at newspaper circulation as a measure of how well informed the citizenry is, and they show that it affects response, as well as they have a measure of how electorally competitive each state is, and again that they show shapes a response of the government to calamities. And sort of so our paper sort of contributes to that literature, but we're looking at a one-time response as opposed to one-time shock as opposed to multiple shocks over time, and sort of looking at institutional differences across countries. There is, of course, a broader literature that talks about democracies tend to make better policies with regard to health, or this paper by Burgess et al. About road building in Kenya, and our paper sort of connects to that literature as well. So the data sets we use for the COVID-19 cases, we use the ECDC data, but we are only using the date of the first reported case. We are not using any other data on daily cases or deaths. So the only information we use from the case data is when the first case was reported in each country. And our primary outcome variable comes from the Oxford COVID-19 government response tracker. They have daily data on various policy measures that include these measures related to closures of public places and restriction on movement of people, as well as sort of more medical kind of response. And they have their own stringency measure. We don't use that. We use their sort of the original granular data to compile our own index, and I'll talk about that. So that's our sort of main, that constitutes our main source for the outcome variable. For the political data, we use the Polity score from the Polity4 dataset, which gives you information about how democratic or autocratic a country is. We hand code data on election results for the current head of the state in each country, for the democracies, of course, and the date of elections and the date of the next election, so we know how much time that is left till after which they will face another election. And then we use the press freedom index from the Reporters Without Borders website, which gives us a sense of how free the media is, which we're going to use to get at heterogeneity. So in the full sample, we have 152 countries and a daily panel starting from January 1st, running till May 6th. So coming to the two indices that we create out of the Oxford dataset. So they have 8 variables that track closures of public spaces, schools, other public gatherings, restriction on movement internally, restriction on foreign travel, etc. For each of these measures, they basically code the degree of response as 0, meaning no restriction, 1 meaning some restriction, 2 meaning even greater restriction. In some variables they have 1, 2, 3 depending on how they grade it. With regard to health policy, they have 3 specific categories on which they track each country: public campaigns regarding COVID-19, sort of informing people about the dangers of COVID-19 and concomitant behavioral changes that citizens would have to undertake. Testing, again, what are the criterias of testing? Accordingly, they grade accordingly they code the variable. So one meaning only test based on if you have symptoms. Two is if you have been contact with come in contact with somebody who has been found positive, etc. And similar with contact tracing. So basically, higher values of for each code represents a greater aggressiveness with which that policy is pursued. Okay, we combine the 8 policy measures into a single, what we call containment policy index, which ranges from 0 to 100. And the health policy, the 3 health policy measures, public campaigns, testing, and contact tracing, we combine the 3 into a health policy index, which also ranges from 0 to 100. This sort of indexing part, we use the similar method as is used by the Oxford guys to prepare their own stringency index. So we follow their method, but we apply it to separately to come up with these 2 aggressiveness measure on containment as well as health. And our outcome variable is log of index plus 1. So basically, we as I was referring to earlier, we track policy aggressiveness, and we do not comment on actually policy effectiveness, meaning whether these aggressive policies were effective in reducing death or not. That sort of we are kind of silent on, and I can talk about why we are doing that. I think that's a much harder question to get a handle on. Our definition of democracy, to be very simple, the polity score ranges from -10 to 10, higher number indicating more democratic institution with regard to sort of selection of the chief executive of the state. So we define democracies as countries with having a 0 or positive value of polity, and the rest are defined to be non-democracies. Our results remain same if we change play around with this definition. So this is the sort of CDF of first cases. So fraction of countries with at least 1 case. As you can see, it's going over time, and the 2 vertical lines are who are declared the coronavirus to be a public health emergency and a pandemic. This is the distribution of countries around the days relative to the first case. So 0 meaning that's the day when the country registered a positive, the first case. Negative meaning pre, and positive meaning the post. So we have daily data. We collapse this data at the weekly level and run regressions at the weekly level. And that's because this coding don't change so much day to day. We see greater variation over weeks. So that's why we use the weekly version of it. This is the sort of 5-day moving average of the containment policy measure by democracy and autocracy. You see that there is a difference between autocracy and democracy in the pre-period. So autocracies seem to be more aggressive in the pre-period. So they are kind of taking much more preemptive measures to have restrictions on movement and closing down public spaces than democracies. But right after the first case is registered, you see democracies kind of matching up with the autocracy in terms of aggressiveness in the raw data. This is with regard to health policy, where we see a lot more action, at least with regard to democracy. We find that, again, autocracies are much more preemptive in their policy response. However, right after the first case is registered, democracies are very quick in ramping up their testing policy, contact tracing policy, and public campaigning. And in fact, they surpass the autocracy. The nice thing is that even though this is kind of a raw plot, or the 5-day moving average, all our regression results is going to replicate this. So what we're going to do is we're going to run a regression on this weekly variable of our outcome, weekly outcome variable on these week fixed effects, and we interact each week with the dummy democracy, and we want to see whether this coefficient changes after 0. Okay. And that's sort of what we'll plot. So that's the specification. And so in containment policy, so this is the plot, all coefficients are with respect to the week number -2. So 2 weeks prior to the countries hit their first case. And you see some effect going up, but on week 0 it's slightly significant, and then it remains stable, but not that significant, sort of showing that the response was kind of similar after. But with health policy, we see much stronger response. So it's significant throughout up till week 6. So that's 1.5 months later, the case was registered. Even then, you see democracies surpassing autocracies. And we want to understand whether actually it's driven by something about institutions with democracies, or something else that is different about democracy. So maybe health systems are better in democracy. So to get at the institutional question, we look at media freedom, electoral strength of the head of the state, and distance to next election. And within democracies, we find that countries that have higher media freedom, higher electoral strength, meaning the chief executive got more votes in the last election or got more seats, depending on whether it's a president or a prime minister, then their responses are even more aggressive within democracies. So this is the result where the sample is democracy and the interaction is with higher than median media freedom countries. So you see that those countries, even within democracies, are even more stringent or even more aggressive with regard to their health policy. So this is all with regard to health policy. Similarly, with countries where the chief executive got higher votes or seat share, they are much more aggressive with testing policies and contact tracing policies. We find similar with election distance. So basically, if the election is more distant than the others, then you seem to respond more. But again, the results are a bit noisier than the others. And finally, we find that the media result and the election performance result are driven by the presidential democracies, while the election distance result is driven by parliamentary democracies. So let me stop here. Thank you.
Okay, thank you very much. So Penny has been keeping an eye on the questions. So would you like to?
There are a few, and my suggestion will be to take them as they were posted. So Anirban, would you like to ask your question, please?
Sure. So it's very interesting, but one thing, so I like the fact that you looked at heterogeneity within democracy, but one important factor could be the extent of decentralization. I mean, that in some sense could, because, you talk about Kerala, for example. Kerala, one of the strengths was that the local communities were able to take action, right? So,
I see.
Any way you can account for that?
Yeah. I'll check if we can. Yeah, that's a good point. I think we can think about coming up with a measure of how decentralized power is within the democracies, and see whether that matters for policy.
Just
however,
to be clear,
sorry, yeah.
So the effect of decentralization is ambiguous here, right? Go ahead.
Yeah, I was going to say that it may, decentralization may matter more for policy effectiveness, something we do not comment on. So maybe the same testing policy would result in lower deaths if it's more decentralized. So yeah, I agree with you on that.
Okay, thank you. So Irma, would you like to ask your question?
Yes, thank you. I found it very interesting as well. My question here is, I guess all these results are effectively comparing autocracies with democracies, even the regression coefficients as well. But if you look at the graphs at the beginning, it looked like autocracies were reacting earlier than democracies. My concern is why they were hiding those first COVID cases, and they were just making them public once they had already reacted and put some policies into place so that they wouldn't look that bad. Then that's why initially, before the 0, you have the red line was on top of the blue line, probably because of this, because they were reacting. So then maybe the results, the difference that you find later on are there just because the first case, I'm not sure you can really interpret it like an exogenous cutoff in here. I'm not sure whether this can be solved somehow, or whether you have thought about
right.
it.
So I mean, it could be that, yeah, so the first case would have arrived earlier than what is reported, which could explain why maybe some countries we do see, for example, started responding in the negative zone. You see that the blue line started converging around after days -7. So it could be that, these countries knew, some of these countries knew that they have the cases, they have been exposed. Which is why we take -2 weeks as our sort of benchmark difference to see how the differences later match up to that. So because the lines are kind of parallel in, -14 and before. So yeah, so that's our main reason why we took that as our benchmark. But you're right. I mean, it could be that they knew that they have been exposed earlier. There is some people who are actually working on the case and death data, trying to show that they seem to be more manipulated by autocracies than democracies, using patterns in the data. So which is actually why we do not use the case and death data to look at policy effectiveness. But yeah, we can play around with changing the cutoff and see whether our result changes then. Yeah.
Yes, no, thank you.
Okay, so I think Amrit would like you to show again your equation, please. If you could show us your slide where you have the equation.
Oh, equation.
Yes, the next, that one. Is that Amrit?
Okay. Yeah. That's all I wanted to say. Okay, thank you. It was, that appreciate it. I'm good.
Okay.
Okay, Bansi, are we still okay with time?
Well, we're a bit running over, but we can take
because you have a
the
question,
session.
so that's why I'm asking.
Yes, no, I do have a question, and this is basically around, how autocracies are formed and so on. And I think I was reading something about how Singapore is quite autocratic, or how its institutions have been influenced by a need to control TB in the 50s and 60s and 70s. And so that, there's a correlation between a need to control these types of infectious diseases and autocracy that will also matter for, how the policies adopt. So I wondered how to think about that.
Yes, so exactly. So which is why I think, as we are writing the paper, we're trying to be careful not to use the word causal too much or causality too much. So I think the main purpose of this exercise is to first demonstrate that that democracies seem to be responding differently than autocracies after controlling for a lot of observables. So we have country fixed effects in all the regressions, for example. But it still could be the case that the reason why democracies are responding differently is because they, to begin with, had very different health systems in place. And as you are pointing out, some countries could be more democratic because they were forced to develop their health system differently. I mean, there could be all kind of endogenous relationships going on. So we are not claiming, our first observations is that countries with different institutions respond differently. Question is this differential response due to the political institution, or is it because something else that is correlated with political institutions? For that, I think where heterogeneity will help us a little bit. What we can say so far is that at least part of the differential response is due to political institutions. So we do see, for example, that within democracies, countries that have if the current chief executive got a lot of vote in the last election, he or she seems to be much more confident in being aggressive with the health policy at least. So that gives us a little bit confidence that there is something to do with political institutions. But we definitely need to be cautious in the way we interpret this result as whether or not it's driven by some political factors only.
Okay, thank you. Amrit, would you like to make a quick comment?
Sure, yeah. My comment is just that I think you could use this framework to look not only at how democracies have responded to the crisis, but also to see how they, relax constraints and, move out of lockdowns.
Going forward, yes. So
yeah,
you're
going
right.
forward.
So you see, as you see already, with regard to health policies, you see some time climbing down after a few weeks, after 7 weeks, 6-7 weeks. So yeah. So we could do that actually. Yes, that's a good point.
Okay, thank you very much, Sabya. We're going to move. So is there any other question?
Yes.
I have a quick one, very general one, Sabya.
Yeah, hi.
just a comment to say, actually, I've just been feeling that a lot of democracies are really not functioning as democracies during the crisis.
Yeah.
So what do we make of that?
So I think
in a sense, it's like the states haven't been able to do what they're supposed to be able to do. So health policy has really been functioning very differently. And so one has to be careful interpreting how much of this is due to democratic institutions, because a lot of those institutions themselves have been undermined during the crisis.
Right, yeah. So, the media freedom index may be proxying for some of the things that you were saying. So we see that even within democracies, the response is much more vigorous for countries that have, that rank much better in the media freedom index. So India, for example, doesn't. So India would
that's
rank...
an interesting comment, because it might be that government action is guided by news reports of what's going on. And if you really believe that's the case, then I think that could give you a really nice angle on your paper.
Okay.
That's not been really explored. So I think you could benefit from not saying that this is just a given set of institutions and then a shock hits and they behave differently. The institutions themselves are transformed during the shock. And looking at how that happens might give just a nice twist to your work.
Okay.
That's it.
Okay, thanks.
Okay, thank you, Sabya, and everyone else. So we're now going to move on to the next talk. Zaki,